Welcome to this morning's session. I'm Esther Bromley. I work for Support Staffordshire, and I've been working quite closely with the Supportive Communities team over at Staffordshire County Council to develop and deliver a series of different sessions, of which today is about COVID, and it's actually the last one I'm going to do on this particular topic. So just a bit of housekeeping to begin. Obviously, you've come in on mute. If I can ask you to remain on mute just whilst the session's going, simply because there's background noise and often I hear my own voice coming back in feedback, which can be really off-putting. So if you can remain on mute. If you do want to speak, feel free to unmute yourself and ask me a question or make a comment. But as I said before, bear in mind that that will be on the video that's being recorded if you do so. Please ensure that your name is what you've booked under, because otherwise I won't be able to send out the information to you, because I only send it out to the people who've actually joined rather than everybody who's booked on. Please do use the chat function as well to ask questions or make comments. That looks a little bit like a speech bubble at the bottom or top of your device. You can use that. I will stop at any point and just answer any questions or comments that are in there. Again, as I said, that won't be shown on the video, so don't feel free to use that as you wish to do so. You will get the slides out at the end of the session. So within the slides today, there's quite a lot of links. There's a couple of videos I'm going to show, but also there's some links to some resources and some information that you might find useful. That's all embedded into the PowerPoint, which will come out as a PDF. So you don't need to write anything down that you see. You don't need to write any web addresses or anything like that. It's all an underlined link within the PowerPoint slides itself. There is a short poll at the end of this session, so I ask two questions. First of all, has your knowledge and understanding changed as a result of today's session? So, do you know a little bit more than when you started? And the second question is, have your skills and confidence changed as a result of today's session? So do you know where to go or where to look, perhaps more than you did when we started? If you could complete them, if you can see them, that would be lovely. I am aware, though, that not every device, depending on your security settings, can see the polls. If you can't see it, don't worry, because there is a longer, more thorough evaluation coming out with the slides. If you do want to introduce yourself, you can do that on the chat. You can say who you are and where you're from, and it's entirely up to you. And finally, it is just to mention, we are obviously online. That comes with a few different issues. Now, I set it for your video to be off. That helps things at your end, because the speed of which, when I show videos particularly, it can be a bit clunky and a bit lagging. So it just helps in that respect. However, you can turn it back on if you wish to do so. If there's problems my end, just stop me and let me know, and I'll make sure that I sort myself out at this end, and you can hear me a little bit better. Worst case scenario, the whole thing drops off, either you do or I do. Just log back in on the link and I'll do the same here. Doesn't happen very often, that, but it has happened twice. So we just log back in. Okay, so moving forward to this session. So these sessions were all developed to enable people who are out there working, supporting, helping people within the community just get a bit more information and know where to look to find out stuff that might be useful to the people that they're supporting. And we've done lots of different sessions. This one particularly is about COVID and the current restrictions, the current vaccine push that's going on out there. And the aim of it really is, first of all, know where to go to find out some information. So where are the trustworthy sources and information we should go to? Why are the guidelines like they are? What's the purpose of them? What do they mean? It helps to dispel some of the myths that float around out there. And secondly, the myths generally, particularly around vaccines, it's really important that we know what the science is behind the vaccines, and some of those stories that do go on around social media and other forums where people, quite frankly, are getting quite scared about the situation, scared about what the impact of the vaccines might mean for them, but also what COVID is and what COVID looks like. So that's the purpose of it, and hopefully you'll take away a couple of interesting bits of information from this session. So to start, some facts. Well, first of all, yeah, it is real. COVID, coronavirus, whatever you want to call it, is real. As of this morning, there are more than 127 million confirmed cases in the world, and over 2.5 million deaths currently, which is obviously a phenomenal amount. We've just approached over a year since we personally went into lockdown in the UK, and those numbers have increased and increased across there. Yeah, it's not new. So again, some of the things that went on around in the early days of the pandemic is people sort of fished out different disinfectant bottles or cleaning bottles, and on the back it said it kills coronavirus. And they say, well, I've had this since 2010. Why is this suddenly a big deal? Well, actually, it's not new, but this is a new strain, and that is its official title. Some people again say it's just like flu, it's just like bad flu. Actually, some people can have mild symptoms, which can be similar to a bad cold, or a bit more symptoms that may mean it's a little bit like the flu. But what's different about this is some people experience some very long-term effects from COVID. Things like respiratory problems, neurological problems that can last many months after they've had the infection. It is more transmissible than the flu. And there's been no prior immunity because it's a new strain. The whole world is susceptible to it. Flu is obviously a serious condition. It does kill around 11,000 people per year in this country. However, so far we have seen 127,000 deaths within this country. So you can see the differences there and why we should be taking it very, very seriously. 15% of all infections do result in a serious illness, and then 5% it's critical. They may need ventilators, etc., may need to be put into an induced coma. So yeah, it is a real problem. It's a real issue that we have to deal with. So what are the main symptoms? Hopefully we will all know these by now, but just to remind ourselves, a high temperature. Well, we don't necessarily need a thermometer to confirm this. You generally feel hot to the touch on your chest or your back. A new continuous cough. Again, if you already have a cough, maybe you've got a smoker's cough, or maybe you have a lung condition. It's a cough that's got worse, noticeably worse. Or maybe you've been coughing an awful lot within an hour, or there's been 3 episodes across the space of 24 hours. And then we've got a loss or a change to the sense of smell or taste. And that is noticeable, and that should be fairly obvious. And those 3 symptoms, if we have any of them, we should be self-isolating for 10 days from when the symptoms started until we get a test that tells us that we are negative, or unless we get a test that tells us we are negative. There are some other symptoms, things you may well have heard of: aches and pains, sore throat, diarrhea, sore red eyes, headache, skin or rash, or a discoloration of the toes or fingers. These are much less common, although they do come. You don't need to get a test unless you've got one of the main symptoms as well as these symptoms, unless you've been advised to do so. So in certain areas, over certain points over the last year, people within certain communities were advised to go and get a test if they had any of these additional symptoms or without the main symptoms. And finally, people are infected without even knowing it. So again, it's really important that we do get tested and we test regularly, because we could be carrying it. I'll talk a little bit more about testing in a little while. So where can we get up-to-date information and advice? That's just going to show you a website. So that's where this link takes you to. It is the Staffordshire County Council website, and its particular page on COVID. Now, across all pages of Staffordshire County Council, you will get this banner, and this banner tells us what current restrictions we are in. Obviously, we are easing today. It is the first day that some of those, the second step down that roadmap has been taken. It's starting to ease. There are additional things we can do. So if I want to go and see what they are, I can just find out more. Let's have a look at national restrictions, and it tells us that actually from today we can start to meet people within the rule of 6 outside, including in our gardens, which obviously yesterday we couldn't. The stay-at-home rule is lifted, but we're still encouraged to stay local to minimise our journeys where we can. Continue to work at home wherever possible. Obviously, outdoor and organised sport can resume, as well as weddings with up to 6 people. So it will always tell us there some key points. What is the latest of restrictions? There's lots more information as we go down. But also on this page, there's some frequently asked questions. So again, tells us what those restrictions are, and it narrows it down. So what does it mean in your particular set of circumstances? So say you are working, what does it mean for work? What does it mean for travel, etc., etc. So hopefully if you get questioned by anybody and you want to answer their particular situation in thorough detail, you can pop to this and hopefully most things will be covered within that area. So that might be quite useful. Go back to that main page. So what else have we got on here? We'll always have those current restrictions, but as I say, you can navigate to that from anywhere on Staffordshire County Council website. It's also got some information on testing, so testing for people with or without symptoms, as well as some lateral flow testing. So if I just have a look at the lateral flow testing, it will tell us that actually there's lots of tests going on within schools. Obviously, school children are starting to test themselves at home with consent. And it's got some information around testing for people without symptoms. So there is community testing if we do need to be out and about within our role. Everybody is able to go and get tested within these community testing centres. So that tells us where they are and what times they're open, etc. We can go and collect the tests ourselves, and then there are other collection points as well. Okay, so that might be quite useful for you to know that you can just pop along and get test kits at any point if you have reason to be out and about. Let's go back to that main bit. It's also usually here, it hasn't at the moment, but usually here if there are particular areas and particular hotspots within Staffordshire that need a particular management. So sometimes there may be particular wards or particular areas that are causing cause for concern. It will be here, it will tell us where they are. Okay. The next bit here is what's the data? So where do we find out all the numbers? Well, here we can go and view it. It's an external website. And what it will show us, it'll show us Staffordshire as a whole, and then we can narrow it down by particular districts. So it's just automatically starts with Cannock Chase because that's the first in alphabetical order. So it tells us here what our Staffordshire daily cases are. Obviously, we can see some big spikes there at the beginning of the year. And obviously this is great. Every time I run this session, I can see it falling and falling and falling every time, which is really heartening to see. And it also gives us our 7-day rate per 100,000, which currently stands at 59. So if you want to have a look at your particular district, you can go and click any of these on the side. So if I just pop Newcastle, for example, I can see how well or not so well Newcastle is doing against the county-wide average. And again, we can see it starting to come down quite significantly. So that might be quite useful for you to know where to get the figures from. There's also lots of stuff around advice and support here. So if you are looking and talking to somebody and maybe other things come along, maybe you're noticing things, maybe there's stuff around scams. I will talk about scams a bit later. There's lots of information in here on the right hand side where we can again signpost people to or get additional support for that person. And then the final thing really to mention is the vaccine. If I just click on that, it tells us a little bit around the vaccine. It's another way that we can navigate through to booking a vaccine and gives us information. There's also lots of leaflets here. So if you are working within a community, a BAME community of some sort, then you can certainly come along here and find a leaflet in their languages, which could be really useful. We do know that there is significantly less of an uptake of vaccines within the BAME communities, and that's concerning because the BAME communities are more at risk from COVID than other communities, so it's worthwhile knowing that that's there. Okay, so that's enough of that particular website. So hopefully that'll give you some idea. It changes every time I look at it, and those menus change because they are really good at getting the key points on there as and when they happen. Okay then, so a little bit about the guidelines, hands, face and space. And obviously I read this morning that we're adding fresh air to it, which I haven't added to this, but there will be fresh air added to it. But Hands. Hands, why do we say that we should be washing our hands? Hopefully we're all really, really regularly doing that. We know it off by heart. We know it's 20 seconds in warm soapy water or hand sanitizer if we can't. But obviously it's because our hands are so busy throughout the day. We touch our face all the time. We touch stuff all the time. We can transmit the virus in that way. So yep, the idea is before eating or touching food, after using the toilet, sneezing, before wearing a mask and removing it. Sometimes people don't tend to miss that one. Before and after visiting a shop. Hand sanitizer, gloves. So gloves, I do see less people now wearing the disposable gloves just to go and do their supermarket shop than I did maybe a year ago. Gloves aren't really recommended, disposable gloves, unless you are in a role where you are doing something like hands-on care work and you need to change those gloves, obviously, between seeing different clients. The reason we don't recommend disposable gloves is because it just gives people a false sense of security, because they pop those gloves on and think, oh, I'm safe now, but it's not necessarily about you being safe. It's about other people being safe and how you can pass on the virus. So if you pop gloves on, you are still touching everything and you're not necessarily washing your hands. Washing your hands is by far the best way to control things. I am aware, however, that some people have skin conditions. They may have dermatitis where washing their hands a lot is going to cause them significant skin problems, in which case, of course, wear gloves, but still wash them. Still wash your hands with gloves on. Face. So we're obviously used to wearing face coverings now of different varieties, and there are particular times when we should be using them, which are obviously all of those different ways. COVID spreads, I'm going to show you a video in a minute, in droplets in the air. And that's what we're trying to do. We're not necessarily trying to protect ourselves, but we're protecting passing on the infection. Sometimes people say, well, it's, I think it's one of my myths coming up, it's my risk to take. If I don't want to wear a mask, I don't need to wear a mask. Actually, it is important that we do wear a mask because we are stopping the transmission of that virus, remembering that people can be asymptomatic. They can still be carrying the virus without even realizing it. People, of course, can wear a face shield, but it needs to be well fitted. It needs to go above the forehead, around the sides of the face and below the chin to give full protection. So properly fitted face shields can work for people who may find face coverings to be a little bit restrictive, a bit claustrophobic, find it difficult to breathe in them. So absolutely, that's an option for people like that. So I'm going to show you a short video, and the video is about how COVID spreads. And the reason for showing it was actually developed last year, and it was in America, but it was developed as people started to go back out into public areas and public beaches, parks, all of those sorts of things, and the worry that brings with it, because people are going to be anxious about getting out and about it again. So this is well worth a watch because it tells us how COVID spreads. It demonstrates how it floats around in the air, but also what we can do to protect ourselves. So I'm going to show it for you now. Hopefully I've got everything on.
On January 23rd, a family in China traveled from Wuhan to the city of Guangzhou. The next day, they ate lunch at a restaurant. One of them had COVID-19, but didn't feel sick yet. Within a few days, other members of the family started showing symptoms. And a few days after that, so did the family who was sitting at the table next to them. The family at this table also got sick. And researchers say this first person was the source of all these infections, even though some of them were sitting almost 14 feet away. But the people eating at these tables didn't get sick. Why? An air conditioning unit right here kept the air flowing through this section of the restaurant. It circulated the virus from this person through the air to these other families. The story highlights something about the coronavirus most of us are just starting to understand: its ability to travel through the air. And as public spaces open up, that's led to some big questions. Is it safe to go to the beach? What about a park? And is a runner gonna get you sick? If we think about our actions only in terms of safe or risky, There's really only one way to guarantee that you won't get sick or spread COVID-19. Stay home, isolate yourself, and have zero contact with the outside world. But maintaining that level of caution all the time isn't really possible for most of us. We need food, we need supplies, and sometimes we just need to take a walk. So the goal in protecting yourself and others from COVID-19 isn't to eliminate risk completely, it's to minimize it. If this side is perpetual quarantine and this side is getting coughed on by a bunch of sick people, it's about pushing yourself as reasonably close to this side as you can. So let's start with going for a walk. And with someone who, like me, has also felt weird about it.
Before I started calling up epidemiologists and talking to them about the risks, I was actually pretty paranoid. And then when I actually started digging into the research, I realized the risks of getting COVID from runners or cyclists outside is much lower than I thought.
Every time we breathe, but especially when we talk and especially when we cough or sneeze, we let out little droplets of water. Some of them are pretty big and heavy and fall to the ground quickly like little bits of spit. Others are really small and much lighter, so they float farther through the air. And these droplets are what's carrying the virus. If a droplet floats and then evaporates, that leaves the virus out in the air for some period of time. And we don't yet know the amount of virus you have to be exposed to get sick. But we do know that you lower your risk by exposing yourself to less of the virus. And Segal says there's 3 ways to do that.
The first is distance. So are you 6 feet away from the person? Duration. Are you encountering this person for 1 second as they whiz past you, or are you around them for an hour? And ventilation. Is there a good airflow moving around you that can disperse any viral particles, or are you in an enclosed indoor space where they're just going to stick around?
The difference between how air moves inside versus outside is huge. To show that, I used this spray which glows under a black light. I sprayed my test subject with it, both inside and outside, from 3 feet away. Even though it wasn't windy, far fewer spray particles reached his shirt outside. The airflow was so much better at dispersing them. And being outside also has an effect on the virus itself.
A virus has this protective coat of moisture around it. There's a lot of things acting on it. So there's sunlight hitting it, there's wind, there's rain, there's humidity, and all of that can work to kind of break apart this protective coat of moisture and decay the virus.
A study in China looked at 318 different outbreaks of COVID-19 across the country. Only one of them involved someone catching it outdoors. That study hasn't been peer-reviewed, but it's consistent with everything else we know, that being outside can be pretty low risk, but your interactions with other people can increase that risk. If you're talking to a friend at a close distance, your risk goes up, and that risk climbs the longer your conversation continues. But if you're both wearing masks to stop some of those larger droplets from spreading, your risk goes down. Shopping in an open-air market is less risky than being inside a store, but you can reduce that risk by getting in and out quickly. But what about passing a heavy-breathing runner?
So let me take you through what would actually have to happen for a runner or cyclist outside to infect you as they pass by. They would have to expel enough viral particles to be able to kickstart an infection. Those particles would have to travel several feet of distance, withstand the pressures of wind, rain, humidity. Then the particles have to actually land in your throat or your upper respiratory tract, or on your hands, which you would then use to touch your eyes, your nose, or your mouth. So all of that is a pretty arduous sequence to execute perfectly.
Going to the beach or to a park isn't necessarily dangerous or safe. The risk can go up or down depending on how we each behave, which means everyone has a responsibility to lower that risk for everyone else.
The point here is not to be cavalier when you go outside. I think we all still want to be cautious, especially as some states are starting reopening.
Changing your behavior to limit exposure to the virus won't reduce your risk to 0, but it could lower it enough that you can breathe a little easier.
Okay, so hopefully that was a useful video that shows us how COVID goes around in the air. Right, okay. and certainly shows us some of the elements of that distance, that space, why the recommendation is that we start to meet out again in gardens, in open air spaces, because obviously inside the air is stagnant. It can float around a lot longer. So some of the myths. Wearing masks can cause CO2 poisoning and or reduce the amount of oxygen. There's simply no evidence for this. Yes, as I said earlier, it can feel a little bit more claustrophobic, but most face coverings allow air to move through them. You don't have to social distance if you're wearing a mask. Yep, it does help. It does reduce the risk, but it doesn't completely stop it. And the same goes for social distancing. The best thing is that everything works together. I manage my own risks. It should be up to me if I wear a mask. Again, it's the main impact is that forward flow of particles from your breath. And finally, a myth, I should wear a mask when exercising. Yep, the advice is don't. You obviously sweat more when you are exercising. That can lead to a buildup of bacteria as your mask gets damp inside where your mouth is. So the most important preventative measure for exercising is social distancing. And yeah, so the guidelines are still very much the same. Keep 2 meters apart wherever possible, or 1 meter. With face coverings, what does it look like? Yep, arm span of an average person, height of a door, length of a double bed. If you can visualize some of these things in between yourself and another person, it helps maintain that distance. Obviously, all three things do work together. They all reduce the risk, but they all are best when they work together. Okay, so that's the guidelines around the science. I'm going to talk about isolation and incubation for the moment. I will be sending this out as a PDF, and I'll show it you just a little bit bigger so it makes a little bit more sense. So let me make that even bigger. There we go, that looks better. So yeah, this is about a household. So a normal household, maybe a mum, dad, a couple of children, and there might be a granny within the support bubble. So living and being with that family as if she was living in the same household. So the first person to get symptoms is the daughter. She gets a test, she tests positive, and she isolates from 10 days from when her symptoms started. So she takes it from that. Granny, she develops symptoms on day 3, tests positive, and she isolates for 10 days from her symptoms started. So she lasts a little bit longer in isolation than the daughter. Mum's fine, she gets no symptoms, so she just stops self-isolating. On day 10, she doesn't need a test. She can just stop at the end of that period. The son, he develops symptoms on day 6, gets a test, but the test is negative, so it's something else. And he again can stop self-isolating on day 10. Finally, poor dad, he doesn't develop any symptoms till day 7, gets a test, tests positive, and he has to self-isolate from his symptoms starting rather than what anybody else in the household had. So he has to go all the way through to day 17 before he can come out of self-isolation. So that gives you a little bit of an idea why some people within households can come out of self-isolation before others. So bubbles, yep, you can form a support bubble if you live by yourself, if you're the only adult in your household, you don't need any continuous care, you've got a child under the age of 1, you've got a child with a disability and under the age of 5, you're 16 and 17 and living with people of your own age without any adults. If you're a single adult and you've got one or more child under 18, and yeah, that point is key. You form a support bubble with one family, not with multiple families, or swap and change from week to week. It is the bubble that you select. So what do we mean when we say a close contact? What does that mean? So you may well get a call from Test and Trace, or it may be that you've been identified as a close contact. What does that mean? So the infectious period is for anybody with symptoms and they've tested positive, it's the 48 hours prior to those symptoms happening. So if I got symptoms today and I tested positive tomorrow, it's everybody I've been in contact with over the last 48 hours. And for those without any symptoms, then maybe I've been in contact with somebody, I haven't got any symptoms myself, but I need to go and get tested, then I will then have to isolate for 10 days from when my symptoms started and 48 hours prior to the positive test. So it does depend if you've got symptoms or not. And what's a close contact? Well, it's anybody within the household. That's fairly obvious. Anybody with direct contact, so that's face-to-face contact within a metre for any duration. Skin-to-skin contact if we've been coughed on, if we've had any contact within 1 metre for more than 1 to 1 minute. So that doesn't have to be face-to-face. It could be back-to-back. And then just being close to somebody, so within 1 or 2 meters on 1 or more occasions on a single day for a total of more than 15 minutes. So if I've just been fairly close to somebody for more than 15 minutes in a day, then I will be a close contact. I will have to self-isolate, or obviously if I travel in a plane or a car. What I would say, a little tip for you, is if you are carrying your phone around with you and if you've got the NHS app and your Bluetooth is turned on, if you then give your phone to somebody else, or maybe you leave it in a locker as things start to open up, and somebody else comes within close contact of your phone, it will be assumed that you've done it, even though you've probably been nowhere near that person. So the tip is, if you do that, if you're leaving your phone anywhere, please turn your Bluetooth on. Otherwise, you may have to self-isolate unnecessarily. Okay, we're going towards vaccines now. We're going to talk about vaccinations. So there's 3 main centres there. There are also lots of additional centres. There's pharmacies, GP surgeries, local hospitals, local centres. They're happening all over the place, but those are the 3 really big ones. The NHS will let you know when it's your turn. However, it's really worthwhile having a look on the vaccine website every now and then just to check what the latest is, because it seems to change almost weekly at times. So it's well worth keeping your eye on who is currently able to get one. So currently offered to everyone 50 or over. Those who are clinically extremely vulnerable, they will know who they are. Those with other health conditions, there's all sorts of health conditions now that are then eligible for a vaccine. They include things like diabetes, lung conditions, obesity, all loads of stuff. I'll show you it in a moment. People obviously live and work in care homes and health and social care workers. They've been available right from the start. Those who are carers and those with a learning disability. So some of those are fairly new. What is important to note is you do have to be registered with a surgery in England in order to be invited. So as those age groups and those available groups for vaccines start to widen, it's well worth just checking with people. Are you registered? Or if you know they've moved, have they moved surgery? Because otherwise their invite's going to go to the wrong place. There are some surgeries as well that are offering it to people under the age of 50 because they've vaccinated all of their patients that are over the age of 50, or at least certainly tried to vaccinate them. So that is just on a local basis, and you can't predict when that's going to happen. But if you are wondering why somebody who's 45 is getting one, has been invited, sometimes that's the reason why. So a few myths about vaccinations. So first of all, big one. So a big concern, I'm going to show you a video in a moment about this, but vaccines normally take much longer to get approved, so these might not be safe. Vaccine hesitancy is definitely not new. There's no doubt about it. It's always been about people tend to be quite worried about new vaccines. However, it is important that we try and dispel some of the myths, and one of them is around why the vaccine has taken quite a relatively short time to get approved. But this video hopefully will show you some of the elements around that. The COVID vaccine can give someone COVID-19. Actually, no, it doesn't use the live virus that causes COVID-19. You might have heard of this, that mRNA vaccines can affect or interact with our DNA. You might have heard of the chip being implanted and genetic material being changed. All sorts of things been floating around the internet. The mRNA, the vaccine never gets into the nucleus of the cell, which is where our genetic material, our DNA, is kept. It follows its instructions and then it's got rid of by our bodies before it can do anything else. We don't know the long-term effects of the COVID vaccines. Well, to an element, that's true, and that is understandably why people might worry. But we are much more advanced now with vaccines than we used to be. It's not like starting from scratch. It's not like starting afresh. It is like starting something where we've built up lots and lots and lots of knowledge through the years, and there's no evidence to say there is going to be any long-term implications from this. I can't have the vaccine if I'm pregnant. Again, it's well worth having a look and having a chat to a midwife just to make sure. But if somebody is in a high risk situation, maybe it's their job, maybe it's a health condition that they've got, then it may well be recommended that they have the vaccine. But there's information about that on the website. So I'm going to show you these couple of things now. These 3 things are links. Let's go back to there. Okay, so first of all, information about the vaccinations. This is coming from the NHS. Lots of information on here, who can get it. So if I just click on that for a second, so it's obviously says all of these, but these are some of those other conditions that put them at high risk. So lots of things in there, as you can see. But I'm just going to go back to this one. So it tells us who can get it. It tells us how it's given. It tells us how to get it, how safe it is, how effective, what side effects there may be. Lots of people do get some side effects. It's a little bit hit and miss who gets what, to be perfectly honest. Then childbearing age, pregnant or breastfeeding. This is an important one. So the approved vaccines do not contain any animal products or egg. There was a myth going around recently that said there's some pork in it. Obviously, to our Muslim communities, that would be, a really not great thing. They wouldn't be able to have the vaccines if it had any pork ingredients whatsoever. It does not contain anything like that. So vegetarians, vegans can have it. All of those people with different types of lifestyles and different types of beliefs. Just that there just to say who can get the vaccine. Okay, so I'm going to show this video again about how the vaccines got created so quickly.
A lot of people have said they are concerned about getting a coronavirus vaccine due to the speed at which they have been made. Here are 5 reasons why people shouldn't be worried. Researchers have been able to tweak current vaccine technology to fight this new virus. Think about your mobile phone. If you have the latest model smartphone, it's made using tried and tested parts with a few updates. Developers don't go back and reinvent the mobile phone every time. Neither are researchers. Just as the technology you use has improved over the years, so has the technology used by researchers. This means things can take a fraction of the time than they did a decade ago. More time, knowledge, people and funding has been made available for coronavirus vaccine research, removing some of the barriers faced by researchers. Instead of reviewing the new vaccines when their trials are finished, the Medicines and Healthcare Products Regulatory Agency, or MHRA, has been reviewing vaccine information when it becomes available. This means a decision on whether to approve a vaccine takes less time. And finally, but most importantly, we have to thank the thousands of volunteers who have taken part in COVID-19 vaccine studies so far. Recruiting participants for research can be the most time-consuming stage of a clinical trial, often taking months or even years. The NHS COVID-19 Vaccine Research Registry has made this process quicker and easier for study teams. Thanks to all the volunteers who have signed up to the registry and consented to be contacted about vaccine studies, recruitment can now take just a few weeks.
Okay, so hopefully there's some really good information in there that tells us why and how the vaccines were made as quickly as they were, really. Now that link there is to the vaccine scams that are happening in around with the different language barriers. I haven't actually got it up. Oh no, I have. There we go. So so different languages within the scams are being talked through. So we've got here Urdu, Punjabi, etc. So that might be useful, depends on where you are and what sort of communities you come into contact with, but that's available for you. Okay, so some myths generally about COVID before we draw this more to a close. First of all, you may have heard this last year, dexamethasone should be a treatment for all COVID patients. It has been truly effective. It's been in the news again in the last week. And there was an idea that actually, why shouldn't we? And certainly something that the then President Trump went around saying, that everybody should have access to this. So it doesn't have any improvements for patients with mild illness. What it does make a difference to is those who are on ventilation or are seriously ill. So it shouldn't be a treatment for everybody. Lots of people will have quite mild to moderate symptoms that they will get over within time without this particular drug. If you tested positive, then you need to have a negative test before you can go back to your normal routines or leave the house again or stop self-isolating. No, you don't. You just have to self-isolate for those 10 days or until that time that NHS Test and Trace will tell you need to stop self-isolating, at which point you can just return to life. You don't need to take a test first just to make sure. Equally, if you've had a negative test, then you still need to self-isolate if you've still been one of those close contacts. Taking temperatures is a good method of assessing safety. Now, I'm sure we will see the return of the temperature guns that will be pointed at our heads as we go into various different venues over the course of the coming months as things start to reopen. By all means, use them if you wish to, but they're not much of real value. People can have COVID without having a temperature. People can have a temperature without having COVID. It doesn't really tell us a lot, to be perfectly honest. 5G mobiles spread COVID. I'm sure you've heard that one. Yeah, well, viruses physically cannot travel on radio waves or mobile networks. And moreover, COVID-19 is present in countries without 5G mobile networks, so they don't spread on that. There's no need to worry in that respect. Being able to hold your breath for 10 seconds and not feel any discomfort means you're free of COVID. Of course, it does affect people's breathing, etc., but the only way to really tell us that we don't have COVID is through a test, a laboratory test. The NHS is closed. We shouldn't bother them. So we do know that over the course of the last year, people have not visited their GPs, they've not visited hospitals, they've not gone, perhaps they've had chest pain and they've not gone and got it checked out because they think the NHS is so overwhelmed, and it has been really overwhelmed, but they're still open. They still want to see you if you need to see them. Absolutely. You should still be taking all the normal precautions that you possibly can. Taking a hot bath prevents COVID. So yeah, our body temperature ranges from about 36.5 degrees centigrade to about 37 degrees. Taking a hot bath doesn't really change that, but obviously it changes the temperature of our skin and it can make us burn and scald. It doesn't kill a disease that's already in your body. Hand dryers are effective and should be used instead of paper towels. There was a huge debate over paper towels and hand dryers last year. Some saying that actually hand dryers kill the virus, and other people saying, well, hand dryers then spread the virus around, paper towels carry it and all sorts. Well, actually, but either are recommended. They're not particularly effective at controlling the virus, so use either. Spraying chlorine or alcohol over the body kills COVID. Don't waste your alcohol like that. It won't make any difference whatsoever to anything that is already within your system. The rates of death is actually really low and we shouldn't be worried. Well, as I said at the beginning, 127,000 deaths in the UK currently. That's not a small number, is it? But also, it is about not overwhelming the NHS. The figures were horrendous back in January. The amount of people in hospital, the amount of people receiving treatments, which means that if you and I were to have a serious accident or serious illnesses in some parts of the UK, we may well not have even got a bed. So that is partly what it's about, as well as reducing deaths of COVID. COVID only affects those who are old or have an underlying health condition. Absolutely, you are more high or at risk the older you are, or the more health conditions you are. Those people who have cardiovascular disease, asthma, diabetes, cancer patients, all of those seem to be more particularly vulnerable. But there are many, many stories of young, perfectly healthy people getting COVID severely and getting that long COVID, so those long ongoing problems. And it's a little bit hit and miss as to who is going to get seriously affected by it and who isn't. Once I have the vaccine, I don't have to worry. There's been a bit of a concern recently with certain parts of the population just starting to think that they are immune. Actually, there is no evidence at the moment to say that the vaccines stop in any way the transmission of the virus. So just because you've had the vaccine doesn't mean to say that you can't still infect other people. There's not any evidence to suggest that at the moment. So you should still be taking the same precautions whether you've had a vaccine or not. Last one. Hospitals are empty, test centres are empty. This is all a hoax. So this is one that definitely floated around last year and earlier in the year. So I'm just going to show you the government data. Just somewhere else to come and get some figures from, really, that are different to what I showed you before. So this gives us our UK summary of all the cases, all the deaths, the situation. We can have a look in our area. But then it tells us, if I pop onto healthcare here, it tells us how many patients are currently in hospital and how many patients are on ventilation. I haven't done this session for a couple of weeks now, and I've seen this drop and drop. At one point that both things were more than 10 times those numbers. I can see how much it's dropped. To see 615 is phenomenal. Last time I looked at that 2 weeks ago, it was well over 2,000. So it shows us how many there are. So again, there's still 4,500 people within hospital that are still needing significant care. It also tells us a little bit about vaccinations. We hit that figure, 30 million, which is amazing, shows us how we are doing with vaccination. Lots more data on there, so well worth a little look. Get back to my PowerPoint. Okay, so scams, we do know that there's been an awful lot of people attempted to be scammed and people who have been scammed. When you get people really worried and really anxious about something, it's really easy, unfortunately, to take them in. And if they think something's going to stop them becoming seriously ill or dying, people are often more likely to fall for it. So I've got here some information from Action Fraud there. Bit of information that talks about the rise in vaccination scams. That's probably the one that's going about the most at the moment. There are some others. I'm also going to send out this, which comes from the National Cyber Security Centre, which tells us a bit about what the top 4 text message scams are. So first of all, fake links to government UK websites for supposed COVID-19 related payments. Lockdown fines, that's a popular one. Offers of health supplements that are meant to prevent you from becoming seriously ill, or financial support that appears to be from your bank. Those are the top ones, and some information on making sure that you can verify who is trying to contact you. A couple more for you. This obviously was last year, but there's a tax refund there. There's ones like this. Watch this to save your life. Blimey, some people will fall for that. Yep, that's the lockdown fine example. That's another example of sterile delivery. Pay a bit extra and you can make sure that you get things that have been cleaned and all the rest of it. People are falling for these things. If people are attempted to be scammed, absolutely report it to Action Fraud so that they can make sure they get to the bottom of some of these things. So the final thing really to mention, just as I draw this to a close, is to think about, particularly if you are a group, an organisation, a person, whoever, whatever role you may be, who is going out back into the community, or maybe you've been doing it for a while and you just want to check that you're doing the right thing. These are some of the things you need to be thinking about firstly. First of all, a hazard is not washing hands regularly, so making sure that you've got adequate supplies of hand wash, hand sanitizer, both for yourself and anyone else you come into contact with. Remember, you're preventing the risks for everyone. Be thinking about the high traffic areas or the communal areas. So what things are people going to touch? What go round, physically walk round a premises and think, what are people going to be touching and handling? Door handles, light switches, kettles, cutlery drawers, fridges, all of those things need extra and additional cleaning. Pinch points. So if you are part of an organisation where you've got lots of people, lots of different groups coming in and out at the same time, how are you going to manage that? Are you going to put in a one-way system maybe, or stagger entry times and exit times so that those pinch points, those gathering of people where they can't help but come together, can't happen? Transport. So if you're needing to use transport, what additional measures do you need to do to make it safe? Maybe you're giving lifts to somebody, maybe you're running a transport scheme, maybe it's a minibus, something like that. Think about those. Not cleaning sufficiently. So how often should we clean? Well, as often as you need to. It's about assessing how many people are in different areas and how often they need to be cleaned. Physical proximity, so being close to people. How can we manage that? So is it about rearranging workstations or tables where people might come and sit? Is it about putting stickers on the floor or signs to help people maintain social distancing if they're queuing? It might be reminding people on the wall, things like that. If we're in a meeting room or space, we might be thinking about how many maximum could we have in there and be safe. Poor ventilation, you saw in the video that actually having that air hanging around, sticking around is the risk really. So can we open windows? Can we get the air conditioning unit sorted? Can it draw in air from outside rather than recycle what's already going in? Thinking about vulnerable people, so assessing whoever it is that you're working with, volunteering with, supporting, what risks do they have? What additional measures do they need to have in place to make sure they're as safe as they possibly can, even if they've been vaccinated? PPE, so assessing what PPE we need, particularly with first aid. So you may not need any PPE, but certainly if you have got a first aid provision, you might want an apron, you might want gloves, you might want a face shield, you'll certainly want hand sanitizer, because if you are going to perform first aid, you need to make sure that you can do it safely for both of you. And the final one really is spread into or beyond your activity or premises. So how are you maintaining your records? So if you had a group of people come together, or even two people come together, and some of them or one of them gets sick from COVID, how are you then going to tell everybody else if they've been the 48 hours prior to that positive test, or 48 hours for those symptoms to start? You need to find a way of making sure you let people know. Okay, so hopefully that gives you an idea. If you're doing any form of risk assessment or anything like that, those are certainly some of the areas that should be on it. That's pretty much the end of this session. Thank you for your time and attention today. Hopefully you've got something out of this, something you didn't know at the start. If you have any questions, don't hesitate to get in contact. Otherwise, feel free to drop off the session and I may see you in the future. So take care and stay safe and well.